Welcome to this module, the social and political context of injury prevention practice. This module will introduce you to the importance of assessing the social and political context when implementing an evidence-based injury prevention initiative. What is the social and political climate? The social and political climate work together, and assessing it is not a one-time exercise. The social context is considered to be the important consideration of a community's perception of the injury problem. The political context includes the current political climate, government priorities, election cycle, etc., that exist at the time when injury practitioners are considering to implement an injury policy or guideline. Take the next few minutes to describe why you think that the social and political context is important to consider when implementing injury prevention initiatives. The ability to make change happen is impacted by contextual factors that exist as you implement a program or policy change. For example, if a community does not feel that playground injuries are a problem or important, or if there is another issue that has more profile in a community, a policy change directed at injury prevention would lack an uptake by the community. Conversely, it would be very difficult to enact a policy change if the politicians or community do not see a playground injury as a problem. One way to begin to activate change in this way is to advocate for addressing the problem by presenting the burden of injury or the injury rates to the community and/or the politicians. Policy change is a complex, multifaceted process necessary to transfer injury prevention efforts from theory to practice. Some of the key processes that occur through successful assessment of the social and political landscape. Throughout this module, you will learn the importance of advocacy and public awareness, champions, and capitalizing on the existing public health resources, the political imperative of legislation and regulation, identifying policy windows to take action to influence decision-making, and many factors that contribute to policy-making. Injury prevention practitioners interested in policy change must continually assess the social and political landscape for opportunities to make a positive difference in communities. In addition to the social context in injury prevention practice, there is another, arguably the most influential context to consider, and that is the political context. The political context is the current political climate that exists at the time when injury practitioners are considering to implement an injury policy or guideline. Injury prevention literature shows the implementation and enforcement of laws and regulations can provide far-reaching and long-term benefits in reducing injuries. Standards, policies, bylaws, and legislation are considered enforcement strategies, one of the E's of the 3E approach to injury prevention. An enforcement strategy can be implemented at differing levels of government, including the municipal, provincial, territorial, and federal level. Adoption of formal policies by boards and commissions also fall under the umbrella of policy and legislation. The regulation and enforcement of policies and legislation are powerful tools in the prevention of injury. However, policy and legislative solutions must be addressed across the spectrum, or with an ecological approach to injury prevention. Legislation is most effective when used in combination with environmental modification, educational activities, and increasing awareness. Injury prevention practitioners must consider several factors to determine their impact on the policy decision-making process. These factors include whether injury is seen as an issue, whether there are champions to move the policy change forward, or naysayers that will need to be convinced, the election cycle, and if there is political will to address the injury issue. By examining these factors, opportunities, or policy windows can be identified. There are 4 general steps that advocates must take in order to successfully influence the policy-making process. 1. Understanding government. 2. Determining strategies and tactics. 3. Building relationships. And 4. Appealing to the government. Understanding how government works is the first important step in navigating and working within the political context. Each level of government, for example municipal, provincial, territorial, and federal, has its own processes and procedures to form and pass legislation. They are prescribed processes by which bills become law or funding requests become part of the budget. When seeking to understand government, it is crucial for injury prevention practitioners to be aware of the level of responsibility, jurisdiction, the decision-making process, current legislation, regulations and policy, and cycles of government. Likewise, each piece of policy, legislation, or regulation will need to go through a process of agenda setting, policy formulation, decision-making, policy implementation, and ultimately, policy evaluation. Finally, the timing of policy within the cycle of government is important to think about in this process. For example, policies that are contentious are less likely to get passed within the 18-month window before an election. Choosing the best strategy and/or tactics to influence policy is not an ad hoc process, but rather one that involves an in-depth understanding of context and options. Strategy and tactics are generally interrelated. However, they refer to slightly different aspects of a public policy campaign. A strategy is a generalized plan to achieve one's goals, and tactics refers to the methods and actions taken to execute the strategy. In determining strategy and tactics, an injury prevention practitioner will have to determine certain contextual factors that will influence their approach. These include determining the prevention goal and clarifying the specific request to government, the available resources and limitations, allies and opponents, and whether the campaign is short or long-term. Relationships play a critical role in navigating both the political and social context. In order to move the policy-making process forward, relationships are often the key to accessing and leveraging resources and relevant information. Building relationships can take different forms. First, coalition building brings together groups of people around a specific issue or for a defined purpose, can expand the resources of a given movement, and also increase the likelihood of success by ensuring a broad base of support. A broad and diverse coalition of support can further demonstrate the relevance of an issue and the impact policy action will have on multiple sectors and interests. For the most part, coalitions are external to the government. Building relationships with the decision makers themselves is an important part of the process. Decision makers are the elected officials or those with influence within government bodies that can facilitate the identification of a champion that has access to the inner workings of government. Building relationships is an important component in navigating the government system and attempting to identify and capitalize on policy windows when they arise. Appealing to government means not only understanding which issues will interest a decision maker at any one time, but also knowing how to frame and communicate the injury problem to make it resonate and align with a decision maker's priorities and philosophy. Sources for this information are official party platforms, involvement of a decision maker in previous causes and events, a keen understanding of a decision maker's own personal biases and personal history, and the issues and concerns within a decision maker's constituency. At the core of appealing to government is also highlighting the return on investment that their involvement and promotion of a policy can garner. Appealing to government also means constructing a narrative or telling a story around the prevention issue that goes beyond the evidence to provide a persuasive, compelling message that necessitates action. For example, tragic incidents can often trigger public concern, demonstrate the human side to the injury issue, and provide a face to the cause. If this concern is effectively channeled, it can produce a rapid and sustained momentum in a political commitment to injury prevention. A hypothetical injury case is provided for you to provide a framework for the important lessons in this module. Please read the case overview. You will be asked to apply content from the module to answer questions about this case study. You may refer back to this synopsis at any time. A needs assessment is a systematic method of assessing the needs of a population or community and using that assessment to make the necessary changes to meet the community's needs. What are some of the questions you think would be necessary to ask to understand the needs of the community for this case study? Conducting a needs assessment is a key part of the process when implementing change. Understanding the social context, for example, the community's perception of an injury problem, and the current political climate for change is a very important part of the needs assessment. Please take a minute to complete the needs assessment table. Think about the type of understandings that you would have to facilitate a change in the community given case study number 1. This is a template of the needs assessment table. There is another model to assist practitioners in thinking about a community's needs. The inquiry model for injury and populations of interest highlights 5 guiding questions for practitioners when they're trying to assess the social and political context in a needs assessment. 1. What is the setting or community's perception of the injury problem? 2. What is the meaning of the injury to the community? 3. What is the political climate for preventing this injury and for sustainability? 4. What resources are available to address this injury problem? 5. What are the characteristics of the community that enable or inhibit the prevention of this injury or the readiness for change? These questions can be used to get at the issue of context, mentioned in Step 1 of the Needs Assessment Table. What are some strategies that you can think of to begin the process of enacting a community in a change process? Take a few minutes to think about what strategies can be used in case study number 1 to enact an injury prevention policy change. One strategy that is used with success in injury prevention is the use of a champion. A champion is a person within the community, prevention organization, or research team that is engaged in addressing the injury problem. A champion can be used to increase the community's awareness of the injury problem and can promote the uptake of an effective injury prevention initiative. This person greatly influences the personalization of the injury problem at the community level. Another strategy used to promote injury prevention practice in a community is the assessment of public health resources. The resources included in this review is both related to human resources and financial. To enact change, a community needs to know the capacity at which they can successfully support the change, as well as the monetary needs that are necessary to implement it. This information is gathered in the needs assessment stage, as mentioned in Step 3 of the Needs Assessment Table. Research has demonstrated that when an injury problem has been identified as an important issue by the community, and the community has available or attainable resources to address the issue, changes will result. Assessing the available resources to enact an injury prevention policy change come with both benefits and challenges. Can you think of any specific challenges that may arise in the case study number 1? Here, we provide one example of a challenge that can come from assessment of available resources. The diverse sectors that an injury prevention issue crosses presents challenges. These include getting everyone on the same page, working towards the same goal, and sharing information. Differing agendas, priorities, and levels of control can sidetrack efforts. However, when aligned, efforts result in a successful solution. Finally, understanding and having available, up-to-date research on all aspects of the injury problem is a key component of making change, particularly at the policy level. Presenting evidence on the burden of injury and on effective prevention initiatives published in scientific, peer-reviewed journals to policymakers can make a significant difference in the ability to mobilize change. This gathering of data would occur in Step 3 of the needs assessment. In case study number 1, a 24-year-old man died from a motor vehicle collision at 9 p.m. on December 15, 2009 in Coquitlam, BC. Carl's vehicle was struck by another vehicle operated by a 19-year-old intoxicated driver. 4 similar incidents occurred within a 6-month time frame in Carl's neighborhood. In this case, what are the important data that an injury practitioner should present to policymakers to enact change? Please take a few minutes to brainstorm what you think would be compelling data to present to enact change. To help you along, we have included the first important variable to present policymakers. Reporting the actual number of fatal collisions that occur in BC, specific to this age group and of the conditions involved in the incidents here, the number of fatal collisions that involved alcohol, drugs, or medications. Here's a synthesis of some of the data that can be presented to policymakers, specific to case study number 1. These data can be presented to begin the conversation about a specific policy change to prevent a similar incident in the future. Making commands around the fact that the 4 similar incidents occurred within a 6-month time frame in Carl's neighborhood would also be compelling data. To develop effective ways to reduce injuries, it is essential for practitioners to consider the social and political context. Doing so improves the effectiveness of tools, strategies, and techniques that are required to navigate the policy-making process and to implement laws and regulations that can result in sustained reductions in injury rates. There are various situations, people, timing, processes, and resources that will impact action and the likelihood of success. To be successful in developing and implementing injury prevention solutions, practitioners require the knowledge and skills for raising public awareness, building relationships with elected officials, and shaping laws and policies. Injury prevention practitioners, including health professionals, researchers, knowledge translation experts, and other vested people and organizations, have valuable information to contribute to their communities and policy that will make a real difference in the lives of individuals. Congratulations, you have completed the Social and Political Context module.